So let's really talk hospital birth and lactation. I have Doula Kaytee joining me from Doula Kaytee, her platform. She is an IBCLC certified birth and postpartum doula, as well as a craniosacral therapist. So I'm going to get her over on here now. We're going to be really talking all about hospital birth and lactation. Hold tight, everyone. Let's get her over here. Let me know what you have going on in these pumping streets. Thank you all for joining. I'm so excited. So very excited. Hey, Doula Kaytee. I'm,
Hey,
how are you?
good. Good. I'm trying to.
That is great. That is great. So I want to introduce you to the Humble Purpose platform. Can you I was like, I want to let them know about you. Please let them know about you.
Hi, I am Kaytee Crawford, or as I'm known on the social media, Doula Kaytee. I've been a doula since 2019, and in Minnesota. I live in Minnesota. I also am I'm a birth and a postpartum doula, but as of late, I've been a lactation consultant. That IBCLC, which is International Board Certified Lactation Consultant, which I had been working on for the last few years. I also have 4 of my own children that I nursed, all of them, and I am married. This is like, I'm so sorry. I took an afternoon nap and it totally threw my brain off.
It's okay.
I'm also married and for 13 years now. So, yeah. Yes, right now I'm doing most of the working, and my husband is now transitioning to his time off, kind of figuring out his passions like I did for myself.
Awesome. So the passion, where did it come from?
Yeah, I think that it comes from the lack of having, which I think is a lot of the times the reason why we do the things we do, because it's something we didn't have. Why I became a doula is from trauma. That's from a trauma experience that I didn't want other folks to have. And then I've always wanted to be a lactation consultant. Not always. Since I started having kids, I've always wanted to be a lactation consultant. I remember going to Lactation League with my first, and it's just a bunch of rich white women. And I was like, how are y'all supposed to help me? So just not having the experiences that I wanted when I was going through the thick of lactation, wanting to make a difference that way. Yeah.
So I knew I was ready. I went stalking your page to find the first post, Instagram algorithm a little bit ago, and I was like, oh, she didn't come here to play any games. You were going in, and you all don't see her stories. She's real deal Holyfield talent. So I knew when I really all the people on my platform, we've talked about the hospital birth process, and I just don't think people know. And so I was like, I want to bring someone on that can kind of give people thoughts on what to expect, not just from birth, because you have the birth doula, postpartum doula, but now lactation. You have to share where you work, but you work, in lactation. And I just think I want people to understand from a perspective of someone living it every day. Because it's different. Private lactation, and you have your own private practice as well. Yes, and hospital lactation is just very different.
Yeah. Yes. And I work in a hospital full-time as a lactation consultant. And I promise if you would have asked me this last year, I'd have been like, you will not catch me in a hospital working as a lactation consultant. And here I am. So yeah, and I think that it's been, I've only been working in the hospital since July, so not long. But in that time, a lot has happened that I'll be in, I'll be honest, I was very judgmental against hospital LCs. I mean, I still am. There's still some trash hospital LCs that I'm like, okay, we could really try a little bit harder. But also realizing there are like actual limitations to being a hospital lactation consultant. And um, I think that when I, started to want to work in the hospital, I was like, oh, I'm going to change everything. I'm going to go in there. I'm going to I'm not going to treat people like all the other LCs treat people. And when I say all the other, I don't mean all the other. I mean like the majority that are not that great and not trying to help people in the long term. And while I do have the attitude of like, I'm trying to help people and make sure that they get the most out of their stay and all of that, I have not and probably will not change a lot that's happening in these hospitals. I've already tried a few times and it has not gone well.
What do you think is your biggest pitfall or your biggest pet peeve with it all?
That it feels very much like a revolving door at the hospital that just drives me wild. Like, I work in a community hospital, so, or a county hospital, so it is a lot of low-income folks that birth there, and folks that are undocumented, folks that, literally just come in to have their baby, have never had prenatal care. Like, so it can be a lot sometimes. So my thing is, these folks, this might be the only time that they actually get any type of medical care or access to. Um, and you're just trying to like give them the bare minimum and then have them leave, which I want them home and comfortable if they do have a home, like home and comfortable, but also like, if this is the only time you're going to come, like, let's try to get everything taken care of now so you're not struggling later. I have really bad allergy stuff going on.
Okay, it's okay.
So like, if they're struggling with latching their baby or feeding their baby and we just send them home, even if we make an appointment for them to come back, they're not always going to do that. Or like, and then if they don't have care or help when they're home, I feel like they're not as, they're not as likely to get support, and then they just stop feeding their baby from their breast, which is fine if that's what they want, but I'm very much in the campaign of support is best instead of fed is best. Like, I have issues with that slogan, because in support is best, your baby will be fed. No matter, like, that is not the question. Your baby will always be fed no matter what. But like, support is best. So like, however, because if you are struggling with lactation and someone's like, oh, well, you could just do formula. They literally just told you they want to breastfeed their baby.
Correct.
And you say, oh, fed is best, here's some formula. That didn't help them, but figuring it out, talking it through, and then, we have like a conversation, we try some things, and then we come to the conclusion, like, maybe we should supplement with some formula or something, then we like supported them in their said, and we come to a conclusion where they are feeling supported. Anyway, all that to say, that does not happen in the hospital.
But your day to day, I think people think they go to the hospital and all of a sudden it's going to be, you're going to get like 100%. Someone's going to come in your room. Oh, it's perfect time. And they're going to be in there for like 2 hours and it's going to be amazing. Can you, that you're sharing usually, every hospital is different in what they provide. I know sometimes their lactation is on every shift. Sometimes it's just the first shift. So it just depends. I know, but what I'm saying, I want to give the real expectations of what to expect. Because I think I didn't even realize people don't even know they go into 2 units. You have your labor and delivery, then your mother baby or postpartum unit, and then your postpartum for the longest, hopefully, in the whole entire stay. And so what can they expect?
Yeah, so yeah, you're right. It depends on the hospital, it depends on the department. I work like 8 to 4:30 most days, and at our hospital we have someone there every day, 8 to 4:30 typically. Even on holidays.
Good.
And we are a baby friendly hospital. I mean,
Yeah.
sometimes I'm like, are we? Are we really hospital?
Got it.
And that's not really shade to like my lactation department. That's more shade to like the nurses.
I got it.
Okay. But I think that a lot of people tend to feel like, and which they should, like their experience should be top priority, right? Like, but unfortunately, in the morning we get a list of anywhere from 4 people to 20 people, depending on who needs help, who's on the floor. So like we have to come to you when we have time, and our discharges are always top priority. So who's ever discharging for the day, we try to see first in the day so that we can take care of them before they leave. Because when they're being discharged, the nurses try to get them out by lunch. Like, yeah, they have a list, they're just checking off, they're trying to get them up. And so I need to get there before lunch, to help them. And generally, it's known that, you're trying to make the visit as quick as possible. I'll stay in there as long as I need to. I know some of the other LCs are kind of an in and out, like 20 minutes or less. They try to, see people. But I typically want to see a feeding if we can. And that's the other hard part. If I come in at 9 and your baby's 8 to 8:30, probably not gonna be able to help you at that time. And I always tell people, like, I'll try to come back, or as soon as the baby's hungry, you can have the nurse call me, and if I'm not in another room, I will come down to support you. But sometimes it turns out either like they don't call me back in there even if they were having problems, or I missed the feeding, and I missed the later feeding, and then they end up going home, or the next day the lactation consultant will help them. Or if it's something where I can't get to them, I will try my hardest to collaborate with their nurse to make a plan for getting through the rest of the day to the next day for a new lactation consultant to see them. And then sometimes if I'm not confident in the feedings, like I'll actually ask if they can stay another night. Like I'll talk to their providers and be like, I'm not comfortable with them going home, like with how the feeding's been going. So that is also, sometimes that happens. But I try to spend enough time in there to help, but not too much time where, they're like, are you leaving yet? You've done all you can you leave. Because like I said, sometimes at the hospital is the only time they're going to get support or help. And so I'm not trying to rush out of there as fast as possible. But the expectation would be to keep it under an hour, like 45 minutes under that, if possible. I just do what I want. I'm not gonna.
I love it. So if someone is going into the hospital and they know they want to breastfeed from birth, what advice would you give them to navigate it all? Like, what are some, like, when you meet that client, if it's that patient at the hospital, what, this serious, like, I want to do this. Like, what advice would you give someone coming in knowing that they wanted to try to navigate that stay to be as productive as possible?
Right. So, I mean, if you feel comfortable working with the hospital lactation consultants, you can tell your nurse when you come in for labor to put you on the consult list, and so that depending on what time you have your baby, someone might come to you sooner than later. Um, but the best thing to do if you really like want to breastfeed, I think the biggest reason I'm called into rooms is for perceived low milk supply. And no matter how many times I tell people they have enough milk.
Okay, at birth?
Yes.
That's good to, okay.
They think they have no milk.
Okay.
And their baby is fussy, wants to eat all the time, and it's because they don't have enough milk for their baby.
Okay.
And so a lot of it is just education. Like, you do have milk. Your baby's tummy is this big. The reason they're crying is because they're trying to make your milk increase, and eating all the time is normal.
Yeah.
Unfortunately. Like, I think social media has ruined us in ways. Like, I love social media, but also, like, people think they should have a freezer full of milk as soon as their baby's born. Like, if they're not, pumping out 3 ounces of milk at the jump. And so, yeah, so the biggest thing I think I would tell someone is, like, remember that you have enough milk. Your baby's tummy is really small. Constant feedings are normal, and just keep feeding your baby. And then when in doubt, skin to skin. Like, skin to skin, and just feed your baby as much as you can or want to. I promise they're getting enough right now at this moment. And then I do encourage, like, follow-up appointments too. Like, if you really want to breastfeed, make sure you have the proper supports in place to continue after you leave the hospital, because that's usually when the poop hits the fan, is after you leave the hospital. So
From a doula perspective as well, because I know you were going in the hospitals long before you and I were in IBCLC, and yeah. I don't think people truly understand how much having a support system to help navigate things you don't know, things you never imagined, things that may go on at birth, especially people that deliver in a hospital, or they start out at home and may go to the hospital. Yeah. But what would you tell someone about assimilating their care team prior to the hospital? Like, do you feel like, I know you told the stories before, about being recognized and being, seen, heard, valued, validated. You bring a care team in, how does it look?
Yeah, I would say start early. I think people get concerned, like, not concerned, they get worried about when to start, oh, I don't want to be too early, I don't want to be too late. Start as soon as you can. Nowadays, doulas are being booked early. And so if you want someone that you really want to work with, because also I feel like a lot of people, when they're looking for a doula, generally know who they want to work with. So reaching out early to get those things secured. And then make sure you're interviewing people too. Like, if you want to work with a lactation consultant, that's great, but also maybe they have different philosophies than you do that you don't necessarily agree with, or they don't have a lot of experience in, like, whatever things you may be dealing with. So it's okay to ask, like, oh, can we do like a 30-minute chat, or like a prenatal, because even if it's a prenatal where you just are getting lactation. My dog is freaking out. Stop it. Even if it's just a prenatal, you're still getting information. Yeah. Like, you're still learning about breastfeeding and about lactation. But if you don't want to work with them, then you like haven't wasted more time, because in those postpartum moments, you don't want to be wasting time trying to find a lactation consultant at the last minute, because when you're having lactation issues, it feels like you need to fix them right away. Sometimes you do, but sometimes it can feel to the parent like, I need to figure this out, or like, I'm gonna, I don't know, not be able to do this, or
yeah. So then And, from all of this, like, how has going into the hospital that you thought you weren't change your perspective on how you look at things, how you practice privately, how you practice in the hospital? Like, how has some of this changed your perspective?
I think I'm sometimes a little easier on lactation consultants now, just because I know that some of the time it isn't because they don't want to or they can't, or they just can't. So I'll give you an example. Tongue ties, which I talk about a lot right now because it is my Mount Everest. I'm also a cranial sacral therapist. I didn't mention that earlier. So I know a lot about the body, the cranial structures, the mouth, in addition to being a lactation consultant. I've learned how to do assessments different ways. And so I don't do assessments on all the babies, just on some of the babies that really are having trouble and not able to eat. And usually they have oral issues. And so I try to reach out to the pediatricians to help me, and they don't want to help me. They don't want to help. And that's kind of what I was talking about earlier about, like, if the people are only here for a few days to get help, like, why wouldn't you do everything you can to support them in having a good experience once they leave? So my whole thing is, like, this baby has oral dysfunction. Like, can you please look at them? If we could fix something, then we could help them out. And they don't want to. Or they look and they say there's nothing there. And because I don't have a DR in front of my name, they don't think I know what I'm talking about. And I'm really sick and tired of these providers telling me I'm not right when I've done the work, and they have not. They're good at what they're good at, but they have not taken the multiple training. Like, I'm trying to raise Brandon right now to take another class. Like, I've done multiple courses on oral assessments, and I'm still looking to, like, further my education and get better at my craft. And you're telling me that I'm wrong? From what? What have you done? What have you done?
But what do you tell the families? Like, I mean, because that's, I have my brothers going through that right now. Like, I'm like, listen, something's wrong. I'm not trained in it at all, but something's wrong.
Yeah.
Nutrition saying one thing, you got lactation saying one thing, you got the pediatric. Like, what do they don't know what to do. And then they're like, it may not even help. And I'm just like, what? So, what do you tell the families?
Right. And so that's the harder part, because a lot around here, to get these things released outside the hospital, it may not be covered by insurance.
Correct.
Sometimes it is, sometimes it's not. So that's part of the struggle, is what do I tell families that I know don't have the means to afford these things? If I'm giving them all this information, then, like, bye, so I'm not allowed to diagnose tongue ties,
of course,
first and foremost.
Yeah.
I can say, like, oh, I see some oral dysfunction, or there's some tightness. I can use, like, adjectives to describe things, but I can't say the words tongue tie.
Correct.
A lot of the time when I'm describing things, the parents will tell me, oh, like a tongue tie? And then I'm like, I mean, yeah, so I think I do have some, ability as a craniosacral therapist to show them, like, more exercises than maybe I would have otherwise, because I'm also not allowed to do that at the hospital.
Yeah.
But I will show them some exercises, some oral strengthening exercises to help with their baby's mouth, and then I try to have them come see me outpatient, because sometimes in outpatient there's a little bit more I can do, or I can try to get them in with an occupational therapist, so a lot of, like, different therapies and things like that. But if I'm like, oh, there's some tightness, I'd love the doctor to look at it, I don't even know if that's helping in that moment. So I've actually recently stopped doing that as much, because the doctors don't want to do anything about it anyway. So again, what am I helping by saying like, oh, there's some tightness, I'm going to have the doctor check it, and have the doctor be like, there's nothing wrong here. This does not impact feeding.
Do you have, people that you may, in your area or know, because I know when you're in the hospital, certain area that like can help, or like, and I get it. Regardless if they go and actually pay to get it done, recover, but to help them make an informed decision, because sometimes
Right.
they don't tell you about what happens at age 6, 7, 8, and all the other implications. People think, they get confused, that they think that ties are about just lactation,
Right.
and I was guilty. Both of my children, had releases done, and I just was like, oh, it's just about nursing, and I'm just gonna pump, and I didn't know. And then I started reading, and had the lactation come to the house, and like, really take a moment to explain to me. And I get it, we pay for both of them out of pocket, but what has been saved, because my oldest it was bad. It was all the way to his roof, all the way up to his gum line. What I saved, though, in the long run, of all the other things and implications, so do you give them a list of people that you trust in your area? Someone does mention, because no lactation professional can diagnose, do you recommend, if they start hinting at stuff like, hey, do you have a list of referral sources?
Yeah.
Where do you start?
Yeah, so I do have a list of referrals. I've been trying to utilize that more lately, just because of the pushback, all the pushback I've received. I'm like, well, fine, then I'm just going to send them to someone who does care. You know? And it's like, also my anger in this whole situation. I'm like, I'm just going to go back to school and become a nurse practitioner and do it myself. Like, where's the logic? There's not there. So yeah, I do have a list of pediatric dentists, and I have been trying to call around to see like if they ever work with people without insurance or low income, or if they ever would think about doing that, be chiro or craniosacral therapist. So I've also been really, telling parents about that more and having them to see them. And that's what I mean by like, I can do a little bit more in outpatient if they come to outpatient care. Because usually in hospital, they're just writing off fumes, like from having a baby. And so if I can talk to them again in outpatient and be like, these are the things that can help with this situation. Let's try to do that. So yeah, I do have a list that I give people, and been trying to utilize that more. And again, just doing more suck training exercises and making sure we have a good plan, so that when they get home and the poop hits the fan, they don't freak out. And
so what do you say to a family that they feel like, you're amazing at what you do, you don't really have to deal with families feeling like you're being rushed, or what do you say when the stakes are high, family feels like they're not being heard? What are some ways that the family can say, can we slow down a bit? I'm feeling a bit rushed. How do they? Because sometimes they don't know. They don't know what they don't know. And I know you can preach prenatal education, but we got a long way to go for it to really take hold. But like, how do you find different tactics, like when you were getting trained, or I know now maybe y'all are on separate shifts, so you don't see maybe the other ones on like how they operate, but like, are there ways to try to slow the situation down for the family?
Yeah, so I always try to take like account of how they look when I come in. Assess a little bit, and then as I'm going, and then saying like, hey, how are you feeling right now? I know this is a lot of information. Do you want to keep going, or is this enough for today? It depends on if they're being discharged or not. I can always give them like a little plan and be like, someone will come see you tomorrow, and they'll follow up on the plan and figure out a plan for home. But it's very much like stopping and just asking them how they're doing capacity wise. And then I also try to ask them like in the beginning what their goals are for feeding their baby, so that I'm focusing on the actual things they want to know about.
I think to the families, they should hear, like, even if no one, like, you can say, my goals are this, you know, telling the person that you're working with, we ask a lot of questions, but sometimes you have to tell them what your answers are, and knowing your answers too. Like, sometimes waiting until you get to the hospital and have it happen, you're flustered or you don't know what to do. So sometimes having your plan in place beforehand, and so you communicate with everyone walking in the room. I want to breastfeed. I want to do this. And if you don't want to do something, of course, no one's going to force, you know, they're not forcing you, even at a baby friendly hospital, it sounds like. So I think knowing what you want to do from birth, and really being able to communicate that. So I have an interesting question for you.
Yeah.
What do you like about your job?
What do I like about my job?
You like, what gets you
the
up?
babies, the families, the babies and the families. What are you talking about? That's the easy answer.
That's easy.
That's what keeps me working there is the families.
Yeah, what keeps you going and
That
showing
is
up
the only thing. It sure isn't these providers.
and fighting the good fight, right?
I'm tired. And like I said, I've only been working there since July. Yeah. And I think I did come with a little bit of, you know, baggage from being a doula and working in the hospitals and being treated like trash a lot of the time. And now that I work there, I have a little bit more stake, but I'm still being treated like trash by the providers. So it's like,
do you see the doulas in there now? So do you?
I don't know. So we're in different wings, so I'm not in labor and delivery much.
So, and then a lot of people don't have the postpartum doulas sometimes in the hospital. They see them when they get home. So yeah, right. You're right.
Yeah, I mean, but I do have a lot. I'm still heavily, because I still do doula clients a little bit. So I'm still heavily in the doula community. So sometimes people will message me or like, I have a client who just had a baby at the hospital, and could you go see them? And so that's nice because then it feels kind of like you have more personalized care that way too. Like, oh, I know you're doula, and like, oh, you know, this is great. And sometimes I can do some CST because they're like, oh, she does CST, and then they're like, oh, can you do CST on my baby? Which is fun. But yeah, the babies, they're so little, they're so tiny, and just like they have no idea what they've been born into. They just want to eat and sleep and poop and just live their life.
Yeah. So no, what do you think? Like, where do you see? Like, I know if we had a crystal ball, you know, it'd be great, or we could change the world like tomorrow. But what do we do over the next 6 months? You know, how do we to help families take an inch at a time? Because we're not going to do it overnight.
Right. I think the biggest thing is just encouraging people to keep asking questions, stay curious, and keep pushing. Like, I had one family where I told them that there was some tightness in their baby's mouth, and they, you know, they said tongue tie, and I was like, I would recommend like they can fix it, because that's the other thing about the hospital. One provider will tell you they don't want you saying all this stuff, and then the other provider will be like, oh, did you tell them about the procedure? Like, so it's very confusing. So I told this family about what the procedure looks like, because I can do that and all that stuff. And so they were having troubles nursing. Like, mom's nipples were bleeding like that quickly. It was bad. And so I recommended the release, and they were adamant in getting this release. Adamant. And had the doctor do it. I don't know how well the doctor did it, but some of it did get cut and released. This baby is doing great now. Like, I saw them in post, like, outside patient, and like, and I mean, I got yelled at about this from the provider, essentially, telling me that I was wrong and she didn't know why she had to do it, blah, blah, blah. It's a whole nother story for another time. I don't care, because this family's doing great now. And even though she might have, however she did it, did a little bit of something, because this mom can breastfeed without pain. And you cannot tell me that it's just because things got better magically. And she was so hard pressed that she had to go and do this procedure on this family because the family insisted that she do it, even though she didn't think it was impact feeding. And this baby's drinking like 3 ounces from the mom every time she nurses, doing well. But before, she couldn't even stay on for like longer than 10 seconds.
Yeah. So
so keep pushing is what I'm saying. Like, this family pushed to have it done, and even though the doctor didn't want to do it, she did it, and now things are way better. So, you know, and ask for second opinions too. Whatever the doctor says doesn't have to be the end all be all. Just go find someone else. Like, you know, be like, great, who else is on your team I can talk to? Because I don't want to talk to you. You don't have to.
Correct.
And yeah, I don't know. Also, Kamala's trying to get, you know, medical bills off of your credit score. So just go get these procedures and then just don't pay your bills. It's fine.
I knew I could count on you for a laugh. I'm just, you know, I'm so happy that, you know, I talk to other people that are in the process of becoming IBCLCs, and you're going to go to the hospital? Like, no. So kudos to you, you know, because like everyone's like, no, you know.
It's hard out here. And it's because you want to do so much and you can't. Like I said earlier, like, I used to be really hard up on how terrible, like, the stories I heard about, like they don't do anything, but it's like, we can't do anything. I mean, some of us still do a lot of things we probably shouldn't be doing, but like, and it's not even that we don't want to do the things. It's like, we know nothing will come of it. Like, that's why, like, if we can get you into outpatient care, we can do a lot more there. But like, in the hospital, they're just trying to get you out as soon as possible. So even if we tell the doctor X, Y, and Z, unless your baby's literally like
not gaining weight,
not gaining weight or doing anything, like, they're gonna be like, you'll be fine, we'll see you in 3 days.
Yeah.
Like,
pediatrician.
You know.
Well, I just want to say thank you for your time. Is there anything you wanna add to this before we go?
No, I don't know. No, probably later.
Yeah. Okay. Well, I thank you for your time. I knew that I knew someone that would, you know, tell it, you know, it's not all, I think I have family members that are work in the hospital, nurses, things. And then, no, I don't think it's ill, and, you know, like, it's an issue. It's just, you're up against a system that has a lot down to
decades
do.
old systems, centuries old systems that don't want to change. They don't want to change.
Yeah.
Like, they follow the CDC, and I'm like, can we follow WHO guidelines? Can we, please? Because y'all just be really saying the most for no reason.
Yeah. So, you know, I just appreciate you fighting. You know, I know every like you said, like I tell people all the time, the people with social media, like, those are the people we don't worry about. It's the one with no Google, the one that's all buried somewhere and you don't know, you know, those are the ones, you know. So I appreciate you having this platform. I appreciate you going out, getting the credentials, you know, to be able to do the work, so families can trust you and, you know, get the care that they deserve. So I just want to say thank you, because I know it's not easy whatsoever. I don't envy it at all, but I appreciate you, because one more person, and you never know, people are looking, and it starts to realize, like, I'll meet the NICU nurses or different things, and I'm like, well, go put yourself in that pump and then you tell me how it goes. You know, it takes one person at a time to really see, like, I can make a difference. And I know it gets hard. I know it's overwhelming, and you can be burnt. People can get burned out. But I know that people don't become nurses and work in the hospital for nothing. You know, they want overall to make a difference, and sometimes the system, you kind of get beat down. Like, I'm not gonna be able to change it, but you do what you can.
Yeah, and I think that it being a system is if, like, for me, I'm trying to work with the system to help my patients as best as possible. And there are some providers who just work the system.
Mm-hmm.
But I'm trying to figure out how to work that system to get the best results for my patients as possible. And I think that's the difference is, you know, yes, we work in a system, but there are ways to get it to work with you, to really do the best for your people,
Yeah.
which is why I'm here, is to help my people.
Yes, yes, yes. So I wanted to thank you for your time today. As long as Instagram works like Instagram works, this is good. I was like, you sure you want me to save this? I'm gonna ask you again. I'm
All
gonna
right.
the first.
We didn't mention the hospital or any people by name. It's
You
fine.
didn't. But you know, if there's ever, you know, I know how life's and people do out here in these streets. So you ever change your mind, let me know. I'll happily, you know. But I really wanted the people to really, not even about the hospital, just to realize all that goes into this, and it's really not a cut and dry. And you're just gonna go in and it's gonna be magical. We didn't even get, you know, all the other things that happen, separation from baby,
Yeah.
all the emotional things. Birth trauma produces purpose. You mentioned some birth trauma from you. I had plenty too, you know, and we don't get in here just to get in this work just for nothing, you know. You get in here to really hopefully try to help people change and go and have a different experience than what you had. So, and you got 4 boys. You didn't mention that.
I have 4 little boys.
4 boys.
It's been real out here. It is.
I got 2. And I can't imagine because they eat me out of house and home at 5 and 4. So I cannot imagine. Not ready.
Girl, these Costco bills are a little.
It's crazy. It's crazy. And you're the queen of your castle. So yeah.
I just had my birthday was yesterday, and I was very much the queen all weekend and yesterday, and they made me cards. It was really cute.
Love it. Well, thank you for coming on. I'm glad, you know, you got some rest because that's important. You look amazing. I'm just on and just, it's just been very, very important to let people know. So thank you for your time.
Be prepared. Have a good team.
Yes. Yeah.
You can fire your nurse if you want to.
I love it.
I'll end with that.
Yes. Well, thank you so much for coming on.
Yeah, anytime.
Have a good day.
Thank you. Bye.